Hello, everybody. Glad to be here. Uh, Glad to have a chance to speak about the very interesting topic, explaining the counterfactual, like reasoning, causal reasoning. I decided to create some short videos about this topic, uh, explaining the differences between the observational reasoning and counterfactual reasoning, and go through the lots of the real-world applications. I'm trying to avoid overwhelming you with lots of the mathematical equations, although we know that the mathematics is a backbone of these topics. Sometimes maybe we need to dive a little bit deeper. Counterfactual reasoning is it's not about the journeys you made. It's about the journeys you didn't make. It's about what could have happened rather than what happened. I will give you some examples from the real world, particularly in the medical science, but you can find lots of other applications in the history, in the social science. I try to see this problem, see these topics from the computer scientist point of view. Let's get started. I would like to begin with a medical example. Imagine you want to create an AI system. I would like to see this problem as a doctor or as a computer scientist. First, I'm going to start with the doctor point of view. A patient comes to your office several times during the period. Every time he come in, you measure lots of the biomarkers, including the blood pressure, glucose, cholesterol level, or biosignals. I don't know. As a doctor, you have to make a decision what to do next. Change drug, change treatment, or lowering dose and that sort of thing. It's very normal. It's a very routine. It's a normal longitudinal data set. Our repeated visits. Let's see it in the computer scientist point of view. I'm really interested in how the computer scientist see this problem. In the next slide, I'm going to talk about it. From the computer scientist perspective, I would say that it depends on the question you would like to address. For example, did this treatment reduce the future risk of the heart problem? There are lots of similar situations. There are lots of similar patients. In this case, we can organize it, the data, and model the data as a tabular problem, tabular data format. Definitely, we have multimodal data, particularly in the medical domain, for example, coming from the MRI and biosignals. But generally, we can frame it as a tabular data. If we came across with the counterfactual question, how could we model this problem? This is a question I would like to answer in the next slide. Counterfactual question. Let's consider this question. What would have happened if this patient had received a different treatment plan? What if this patient had received a different plan?
A counterfactual question usually starts with a what if and ends with a what would have happened. In order to address this problem, we need a causal graph. As you can see here, of course, definitely it's not an ordinary causal graph. It's a time-varying causal graph because there are lots of follow-up visits. Everything changes during these visits. So this problem is called time-varying problem. In this problem, we face with the time-varying covariates, time-varying confounders, time-varying mediators. Let's explain a little bit this graph. A indicates the action. Here is treatment. A drug is prescribed. L indicates to the covariates, biomarkers. And U, it indicates to unmeasured variables. In the causal graph, we have some hidden variables where those variables have a causal effect on outcome. We need to model this. Very complicated graph you can see here. Each of these arrows shows a causal link between the nodes. We need to consider all these causal pathways. In the next slide, I'm gonna, for simplicity, I will give you a simple example about diabetes, and we will go through the graph and little bit investigate and study the nodes, the links, and the causal pathways, and all their effects on the complexity of the problem. Let's see. Let's get started. Okay, let's use a simple diabetes example. The outcome is cardiac event. You can see here. 2 visits. There are just 2 visits. Visit 0, visit 1. HbA1c is a blood biomarker that indicates the level of the glucose in the body, in the blood, and drug indicates to the diabetes drug. Mostly should increase the level of the HbA1c and at the same time increase the level of the cardiac event. And the U is indicates to the unmeasured and hidden variable we don't know, but we almost certainly know that the influence on the level of the HbA1c. On the other hand, HbA1c got a causal effect on the cardiac and influence on treatment. Maybe doctor when see the patient got a high level of HbA1c, changed the dose or changed drug. So you can see here the causal pathways between the nodes. HbA1c here is acting like a confounder. Let's go for a drug. I want to study the causal effect of drug on the other nodes. Let's see the effect, the causal effect of the diabetes drug on other variables. Of course, it's pretty obvious because it influences on the level of the biomarker, because the good diabetes drug should lower the level of the HbA1c and should lower the risk of the cardiac event and influence on the treatment. This pathway, I mean the drug to HbA1c and to cardiac event, indicating the role of the HbA1c as a mediator. This is really tricky because in our graph, HbA1c plays two roles at the same time: confounder and mediator. This is where machine learning couldn't work, actually mislead here. So I want to add one complexity to the other complexity. In the next slide, you can see all the graph with all edges and the dependency paths. You can see this graph is very complicated, and of course different roles of the variables, sometimes as a mediator, sometimes as a confounders. Yeah, this slide shows the full causal graph we have. As you can see, don't forget, this is a very simple question with just two follow-up visits. In the real world, the problem is definitely complicated, more complicated than this example, because there are lots of unmeasured variables, confounders, mediators, yeah, that sort of thing, and different modalities. In the next video, I'm gonna go dive deeper, go through this graph and different nodes, different roles, different causal pathways, and discuss a little bit about their role and their influence on the causal and counterfactual inference. Thank you for listening and watching this video. Have a good time.